Hey, Dr. Robinson, you have just a minute to talk about Mark, the warm handoff that you gave me a little bit earlier today?
Yes, I do.
Okay.
Yes.
Okay,
What do you
great.
think? Yeah.
Well, very, very anxious guy, real nice guy. Basically, yeah, what we talked a lot about was that, yeah, just very anxious lately and having some panic attacks. I know that was your suspicion too. He came in to see you because he was worried that maybe he was having a heart problem,
Mhm.
but you were, luckily ruled that out right for him and are feeling that but you could definitely got the sense that he had a lot of stress going on, which he does. So the main things that I did with him today are I did first off a little bit of education with him about these panic attacks that he's having and how they can develop when people have these fears of having a heart attack. and
Right.
um, and I really reinforced the message you gave him that actually his heart's fine. Not sure he totally believes it yet, so when you do see him back, I think you're going to see him back in a couple weeks. Maybe just reminding him or reassuring him a little bit more about that would be one thing that would be helpful. Um,
Okay.
but what I did with him otherwise was he's been isolating a lot because of his anxiety. He's been mostly staying in the house. So he set a goal that he does have a neighbor that's been asking him almost daily to go out and go for walks like they used to do. So he did agree that he set a goal that he's going to go for two at least 15-minute walks with the neighbor per week over the next couple weeks. And then I'm going to see him back in 2 weeks when he's seeing you. So.
Okay. No, that sounds good. Thanks a lot. He is a new patient for me.
Mhm.
And health anxiety is just, it's a difficult one. I will reinforce the idea that he's a healthy 30-year-old man under a lot of stress, and I'll encourage him to follow up with you. You mentioned education about anxiety. I think
Mhm.
that would be, a good topic for you to, just kind of brief us on at the next provider meeting, just so we know
Oh
kind of
yeah.
what you say and
Yeah.
because that would come in handy sometimes, with people like Mark.
That's I love that idea. That's because we just see so many people, right, who come in with these kinds of panic like symptoms
Yeah,
around thinking it's a heart attack or a heart problem and as well as shows up in other ways too. But yeah, no, I'd be happy to do that. That's a great idea. Thanks
yeah,
for the invite.
yeah. Thanks for seeing him. Yeah.
Okay. All right.